Enough is enough. We as healthcare leaders and healthcare providers very much see that gun violence is in our lane because a lot of these patients that come to us are identified when we see them in clinic. So just like we treat tobacco, again, and alcohol, substance use, there's no reason why we can't treat gun violence as a health issue, and that is our intention. I am Dr. Chethan Sathya, and I'm a pediatric trauma surgeon at Cohen Children's Medical Center, and I'm also the director of the Center for Gun Violence Prevention here at Northwell Health. So we established the Center for Gun Violence Prevention earlier this year after our CEO, Michael Dowling, really took a stance on this issue. Rightfully so, he felt that the healthcare industry very much needed to start delving into the gun violence debate at all levels, including leadership and physicians and all healthcare providers. So as a result, Northwell Health did throw a big gun violence forum in Manhattan last year, where we got together about 100 leading national experts in gun violence prevention to really identify opportunities where we could all come together as a healthcare industry to combat this issue. That led to the development of the Gun Violence Prevention Center here at Northwell Health. Our focus is broadly on four big pillars. We want to approach gun violence prevention as a public health issue. We feel very strongly that it should be treated that way, similar to tobacco, alcohol, and car accidents, and similarly how we've had to deal with that in the past. So our focus areas are research, advocacy, community partnerships, and education, which includes education of our own providers on how to counsel around gun safety, and education in the community about measures to prevent gun violence and gun safety as well. So we really don't want to reinvent the wheel, but we do feel that we have an important piece to play with respect to healthcare engaging in this debate, and we want to collaborate with others to really make a difference. I think as a healthcare system, first it starts really by us looking inward as to how we can make changes within our hospitals and health systems to combat this. So I'll give you a couple examples. We are rolling out a system-wide educational curriculum to teach our medical students, residents, and providers how to counsel on gun safety. That in itself is a very big step. Surprisingly, very few physicians actually counsel patients about gun safety, let alone ask about guns. They find the topic uncomfortable. They don't have the education on how to do so. So it's rarely done. We are looking to change that. We know that counseling for gun safety actually makes a difference. It prevents accidental shootings in the home. It allows for a safer home. And so with our educational seminars, we do hope to roll that out and to make that part of the usual care that we offer. Another big initiative internally will be that we do plan to institute a screening and prevention effort in all our emergency departments where we actually identify patients who might be at risk of gun violence. We identify firearm access among our patients as well, and then counsel as needed. That will allow us to really have an overarching approach among the patients that come to our health system to provide that kind of guidance and to make the environment more safe around gun violence. So I think that's really the first step internally. Those are some big initiatives that we do hope to roll out and could have major impacts to our patient population. And then the next step is to look outward. So what do we do after we identify those patients, right? Some of the at-risk youth that might be at risk of gun violence. We are partnering with community organizations to help them with resources and to make sure that they have longitudinal follow-up. So that is also in the works. And we're also looking to really be a leader nationally when it comes to advocacy on this issue, to engage and mobilize the entire healthcare industry around gun violence prevention. The incidence of gun violence in general across America has been shockingly high. It really hasn't, unfortunately, decreased as we've expected. And as we're seeing, especially during COVID now, with increasing social isolation, economic stressors, and a multitude of factors, gun violence is back on the rise. Whether it be mass shootings or just handgun-related violence, which does make up the majority of gun violence that we see across this country, the numbers are high and have remained high, and we haven't really been able to make a dent in that. At our last forum in December, when our CEO, Michael Dowling, really made that call to action to other healthcare industry leaders, other health system CEOs to join us in this fight, there was a tremendous response. Many, many big health systems and healthcare leaders have been looking to Northwell now to say, okay, how can we engage? And having said that, we have an amazing external advisory committee, which is comprised of the leaders of other gun violence prevention centers across the country who have been advising us on where we can best really have an impact. Because so many people across the country are doing amazing work when it comes to gun violence prevention. We do not want to duplicate those efforts, but we just want to be helpful in whatever way we can. So to build on that call to action, we will be announcing that we are launching a national learning collaborative for hospitals and health systems pertaining to gun violence prevention. And what that will do is that'll really be the first of its kind. It'll bring together hospitals and health systems in an open dialogue to learn about gun violence prevention, including ourselves, to really learn from other experts, to develop best practices, implement those best practices, and then measure quality improvement. That's going to be a multi-phase, multi-year learning collaborative. There's a lot of momentum behind that, a lot of interest, and I think that has the potential to really allow us and others to implement gun violence prevention activities in our hospitals and health systems, and then kind of translate that and be a catalyst for others to do so across the country. Whatever we do here, there are similarities that can be learned from for other countries as well. And likewise, we can learn from those countries too. A lot of the models that we have, based on what legislation might work or what hospital-based community interventions might work, are based on experiences from other countries that have been successful in dealing with gun violence. That's why we do want to approach this as a public health issue. Enough is enough. We as healthcare leaders and healthcare providers very much see that gun violence is in our lane, because a lot of these patients that come to us are identified when we see them in clinic. So just like we treat tobacco, again, and alcohol, substance use, there's no reason why we can't treat gun violence as a health issue, and that is our intention.